Foojan Zeine, and welcome to Inner Voice Show. On this episode, we're going to talk about relationship, finances, and a whole lot more. So stay tuned. Hi, I'm Dr. Foojan Zeine. I'm a psychotherapist. I'm an author and an international speaker. I have hosted my own television show, Inner Voice, in a satellite program for 16 years. Whether it's premarital counseling or through their marriage, how to deal with children, and if they're going through a divorce, to teach them how to communicate better together. In actuality, I think my job is very important to work with individuals and the couples in order to make the most important relationship of their life healthy, which makes them healthy. On my Inner Voice show, I actually interview some of the prominent psychologists and entertainers in English, and I also speak to some of the psychotherapists who are Iranians and the artists who are Iranians, and I speak in Persian to the Persian population around the world, from Iran or Europe or Japan, Australia, all over the United States and Canada, because obviously I was born in Iran.
Where's Dr. Zeine? Dr. Zeine?
Hello.
You also have been trained in my specific methodology and techniques, correct?
Yes,
Are you willing to talk to her after this show
absolutely.
and tell her the step-by-step that she needs to do to deal with what I believe is an addictive personality?
Yes, absolutely.
The family goes through a lot. For boys who are becoming girls, the fathers of the family suffer. They will keep being confused. They look at all the childhood pictures that they've took of their son, and now they look at somebody who's standing in front of them as supposed to be their daughter. Coming up, I'm going to be talking to a psychotherapist about awareness integration model. You really want to know what that is, huh? Coming up. Stay tuned. Hi. I'm Dr. Foojan Zeine, psychotherapist, and I'm here with Nasreen Bafordari, licensed marriage and family therapist. We're going to talk about awareness integration model, a psychological model that I have originated, and Nasreen Bafordari is one of the first therapists who has actually learned and has been utilizing it with her clients. Thank you for coming.
Thank you for inviting me. This is an honor.
Some of the major topics that I actually talk to my clients who are couples are first talking about sexuality. Many people don't know how to talk about sex. Concept of communication about it is something that I actually have to teach the couples and how to do. We talk about sexuality. Many people come into their sexuality in a very automatic way. We can go through the whole experience and wham, have a great time, but being with another human being, it actually takes skills. So becoming aware of every area of how we think, how we behave, how we feel, how we communicate with another human being in order to have an amazing sexuality is part of what we also teach in this AI model.
So much of our sexuality.
People don't talk about finances a lot. They don't have a system. They come from two backgrounds of how they actually have created their finances, and I have to help them create a system and have a great communication in how to follow the system. Another main topic is when they actually have children. Now remember, two people, two backgrounds, two cultures, two sets of values are coming in, and now they actually have to bring those together, and that's where they need how to communicate, be flexible, and really negotiate on one way of handling their kids. Duet, sometimes you guys are entering each
Yes.
other's space
Yes.
and singing together, and
Yes.
then solo. How does that experience for you?
The funny thing is,
In-laws, we have to deal with them. They're always there. They're going to be there. We didn't marry them, but they came with a package. So somehow we have to really, really work with it. And if I have to actually add one more topic that I've had to deal with a lot of couples and individuals is addiction. Whether it's an addiction to alcohol or drugs, pornography, cell phone, computers, is one aspect that really, really affects the person's life and in their relationship. With people who are going through recovery from addiction, they've had some sort of a trauma in their childhood. And when we've worked with the awareness integration model with them, clearing the trauma, the choice and the chance for them to relapsing is really minimized. I have been in the field of psychology for about 25 years. I started with seminars in ontology and psychology almost the same time. And I know you were part of the pilot study that we did, and in the result of that pilot study was that people were actually minimizing the depression 76%. They were minimizing anxiety 64%, and their self-esteem was rising about 43%. Now those are astonishing numbers.
You know, I wanted to go through it. I wanted to experience what my client would experience. So I asked you to work on me as a model for the group that was being trained.
Hey everyone, thanks for watching. If you like what you see, you can see more on my website and my YouTube channel. And if you want to contact me, I'm on Facebook and Twitter. Bye-bye. Hello, I'm Dr. Foojan Zeine, and welcome to the Inner Voice Show, the show that's about you and all that matters to you from a psychological perspective. Today, I'm very excited to have Dr. George Lindenfeld with me. Let me tell you a little bit about him because he's going to tell us about a new therapy model that he has actually created. So let me tell you a little bit about him before I ask him to join us. Dr. George Lindenfeld completed his undergraduate training at SUNY at Oswego, New York, and then his master's degree in City College of New York, and then his PhD in Utah, the University of Utah. His residency in medical psychology at the University of Oregon. And actually University of Oregon Medical School in 1971, and he has obtained the status of diplomat in clinical psychology awarded by ABPP 1980. As part of his practice with veterans, he has monitored ongoing memory research and pursued the non-invasive potential of neuroacoustical intervention. This has led him to develop reset therapy, which has shown an enduring remission of the emotional aspect of post-traumatic stress disorder, PTSD. He has authored a couple of books, PTSD Symptoms Reversed Permanently. That's a blessing. We really want to hear about that. And he has also been the primary author of two papers entitled Resetting the Fear Switch and Brain on Fire. And he will be releasing his second book in a series entitled Brain on Fire, A Therapist's Guide to Extinguishing the Flames of PTSD. Welcome, Dr. Lindenfeld.
Well, thank you. That's a wonderful introduction.
It's great to meet you. I actually met you on LinkedIn. Got to know a little bit about your program. I've worked a lot with post-traumatic stress disorder, people who have had a lot of trauma in their life, in their childhood, whether it was different types of abuse or had gone through war. And it was very interesting for me when I saw your model, and I wanted to definitely talk to you about it because, first of all, we've had a lot of different types of therapies, such as cognitive behavioral therapy. We have eye movement desensitization and reprocessing. We have other therapies, which just kind of like desensitization therapies. I created my own model of awareness integration, and I definitely work with trauma in that way. However, you have developed a therapeutic model, reset therapy, which actually works with acoustics and audio. So can you tell us a little bit about your therapeutic model itself?
Sure. This is based on how the brain restores memory. We used to think that it was etched in stone, and then we had the model of the filing cabinet where you pull out the drawer and get the file.
Yes.
Then we went to the computer model where you thought about it as a computer network. And now we're looking at neuronal networks in the brain. But to get to the point, after the initial memory is stored, and let's say it's trauma, it is consolidated in the brain anywhere from a couple of hours up to a day or so. And then each time it's triggered, it's retrieved and restored, which is called reconsolidation. Now, neuroscientific inquiry has shown that each time it's restored, it's open to potential change.
Oh.
And that's where sound comes in. The sound blocks the reconsolidation process.
Oh.
And the emotional component drops out. So the person is left with the memory of what happened, even a greater memory, but they don't have the emotional baggage that goes with it. They're free of it, by and large.
Now, when you talk about sound, do you mean any type of sound, or is it a particular sound that you are introducing at the time of retrieving the memory?
This is a special sound. My patient will wear a headphone. The volume is first adjusted, and then a frequency dial or knob is adjusted to resonate with the target they bring up in their mind. In this therapy, they don't talk about the trauma. They light it up in the brain using all of the senses: smell, visual, body senses. The more they can light it up, the more likely we'll get results. The sound is adjusted to resonate, connect with that target. That's step one. A second knob called the disruptor knob. This is part of the unit called a BAUD, B-A-U-D, developed by Dr. Frank Lawless, L-A-W-L-I-S.
I know for Dr. Lawless, yes.
Yeah. When the disruptor knob is adjusted, it offsets the frequency knob by upwards of 20 hertz. Now, I don't want to get too technical, but the left ear hears one sound, the right ear hears another, the brain hears it as one. And that special sound blocks that restoration of the emotional part of the trauma memory.
Is that
So
like a
it is
binaural beat? Is that
Yes,
like a
it is.
binaural beat?
It certainly is.
Okay.
You're familiar with this.
Yes, because I created this series of tapes for hypnosis, and I included binaural beats into it in order to go into the alpha wave much faster and the gamma wave, so that they could actually take in and store it. And you're talking about utilizing an equipment that utilizes binaural beat, and then for that matter, when you're working with your clients and utilizing this, then you are, as you're retrieving the information from the past, from the trauma, then what actually happens is that the binaural beat resonates with the lighting up of what's going on with the actual trauma in your body, and then it doesn't allow it to recreate the same thing. Now it gives it a new way of a new experience without all of the emotional baggage. Is that what I'm hearing?
That's where the term reset comes in, and you're exactly on. What reset stands for is reconsolidation enhancement by stimulation of emotional triggers. Mm-hmm. So this is a form of exposure therapy, but I tell my patients, when we tune it in correctly, you only have to go through that horror one more time. I have seen that repeatedly. I have seen the brain reset, and I know you're going to say, oh, come on, in 5 minutes.
Wow.
Plug my name into Google, take a look at the front page article in the Sarasota Herald Tribune. A reporter was there taking the story. You'll read the story of Marine Wade Risha. This is exactly what happened with Wade.
Wow. And I know
Yeah.
that you have worked a lot with veterans, and I know that they come back with a lot of post-traumatic stress and going through all of the scenery that they had to go through. Sometimes it's really excruciating, and they re-traumatize themselves. Any person who has gone through an extreme trauma has the potential of re-traumatizing themselves as they go back to all the memories. And as I'm hearing you say that because of this type of equipment and the sound that is being utilized, that it does not allow the re-traumatization to happen again.
If we tune it in to resonate correctly. Now, maybe some of your listeners don't fully understand what resonate means.
Please tell
So
us.
I'll give an example.
Yeah.
A big truck comes by your home and rattles the windows, I think is a good example.
Okay.
That's what resonance is. Now, there's another thought I want to throw out. Some people think that this is an entrainment process. It is not. It is a reconsolidation process. Entrainment takes time, lots of time. This can happen almost immediately.
Why do you think it happens immediately? How is it that you think that resonating the sound into the system changes the brain frequency so fast, based on your experience?
If you'll read Dr. Bruce Lipton's work, he talks about trauma affecting the system at a genetic level. He also proposes that when that level experiences trauma, it goes into a defensive protective mode.
Yes.
Growth stops. The resetting puts it back into a growth mode. The person begins to socialize again. The patient begins to interact with others. I have a term called the neuronal network of PTSD. Perhaps I'll explain that a little later in our discussion. But basically, people that are traumatized really don't fully comprehend as they did before they were traumatized. They don't get it.
So the brain kind of stops because it's trying to preserve itself. Is that what it is? That they just kind of like freezes?
It's in the defensive mode. And let me walk through that network.
Please.
So the prefrontal lobe kind of deactivates. There's an area called Brodmann 19 that lights up, and that's where the flashbacks come from. There's some speech centers in the left frontal part of the brain called Broca's and Wernicke. They deactivate. So in effect, the person really can't express fully what's going on with themselves, nor can they understand what someone else is fully saying to them. Of course, the amygdala goes on fire, and that's where that term brain on fire comes from. That's the seat. Goodness, should I tell you this?
I think
The
so.
veterans call it a cobra, but they use the term PO'd cobra. And they say the poison from that cobra infests everything around them. People they love, people they work with, and it drives them away.
True.
It also infects therapists. People that work with trauma develop secondary trauma
Yes.
because of the poison.
Yes. No, that's very true. Very true. I've worked with a lot of trauma in domestic violence, in abuse, and in war, and I know that as a therapist who's sitting with the client, that the essence of their pain is in the room, and it becomes part of our body also. So I definitely have personal experience of what you're talking about. And at one point, if we keep putting ourselves in that position, we also get burned out by everybody else's trauma. So it's very hard also on the trauma workers, everybody who's actually working with trauma patients. You've talked about the essence of let me ask you this: how did you come up with this? How did you explore and develop this type of a method?
my first name is George, and there was a cartoon called Curious George. and I like that cartoon, so I picked up on it. I've always been interested in neuropsychology. I've been a neurobiofeedbacker since it first came out forever ago. And about 6 years ago, my daughter, who is also a psychologist, introduced me to the BAUD, developed by Dr. Frank Lawless, which stands for Bioacoustical Utilization Device.
Right.
Now, because I became fascinated with that, and as a little aside, the second chapter of my new book is called Therapist Burnout. And I talk a lot about that there. But I got burned out with biofeedback, neurofeedback. Not that it's not a wonderful procedure, but looking at Pac-Man for 5-10 years kind of got to me.
Yeah.
So being curious, I wanted something else, and I really got into this bioacoustical stuff and asked my patients if they would explore this with me. Now, by the way, there are two types of trauma that I've involved with, and one is incident specific, so maybe at a specific situation in a war experience. The other is developmental, and that can come over the course of a lifetime, such as sexually abused,
Right.
People that experience that as children, and so forth. This works with both, but it works in a different way. With the developmental group, it takes time, so it's more like traditional therapy. But the insight comes after the sound, not before it. As the frontal lobes reactivate, the insight comes from within the patient. I'll take a breath here. Maybe you'd like to comment or ask about that.
As I was listening to you, I was imagining if I was the patient, if I was the client and had trauma and came to you, what would this whole thing look like? Would it be that I'm sitting in your office and I'm working with neurofeedback and the computers and the equipment BAUD, all of them together, as you as a therapist monitoring me and monitoring what you see in the computer about where the brain lights up, and monitoring how to resonate the sound with where my brain lights up. So tell me a little bit about what it all looks like for someone who comes to you for treatment.
Well, I don't use the biofeedback, neurofeedback. One of my colleagues in Sarasota, his name is Dr. George Rizal, he's the expert in brain mapping. I used to do that way back, but stopped when I burnt out. It's called a QEEG.
Yes.
And he will do that pre and post. And I must tell you later about the 36 combat veteran study we are looking to do. But he'll do the pre and post and a 3-month follow-up. So that's his expertise.
Okay.
When I treat, first I explain the process. I don't want to know the details of the trauma. I ask the individual to hold that inside to be able to light it up when it comes time. I also ask them to remain quite skeptical, particularly the veterans, because they don't trust anyone. And many of our current therapies require a trust relationships. I don't agree with that. I don't believe you need a trust relationship. I postulate that trust comes after my patient experiences relief from the trauma. Talk about trust, you ought to see it when that happens. Their eyes light up.
Yes.
A human being enters the body again.
Yes.
The 1,000-yard stare disappears. It is amazing.
Yes. So as they are sitting in your room, they are working, you put the set on them that is the resonating, the BAUD equipment?
I show them the BAUD, I put it in their hand.
Right.
I show them that it's battery operated so they understand, they won't be shocked.
Okay.
I show them the headphones. I've got a nice set, a quality set of headphones. For people with hearing problems, by the way, I just picked up a bone conduction headphone.
Oh.
I think this would be wonderful with autistic people also
Yes.
that are irritated by sound. And I explain to them what we're going to do and then go into the procedure of how they are to inform me when the pitch resonates with their target. Of course, I tell them I want you to light it up inside. I want you to use all your senses, whatever was involved when it first happened. Smell, sight, body sensation, whatever was there, you recreate inside as though you're in the movie of what actually happened.
So when
That's
you
how
say,
we begin.
so when you say, I want you to resonate inside and light it up, how does a patient know, how does a client know what that means? Like, how do they experience it resonating and lighting up inside?
Yeah. I don't ask them to resonate. I ask them to light up.
Light up,
Just
okay.
to correct that. Then when they've done that, they wave at me, and I begin to adjust the frequency knob. Now, I've explained to them, when you sense it connecting to you, wave at me. I suggest to them that when it resonates, they will feel an intensification of the target.
Okay,
It'll seem stronger to them.
okay.
Now, mind you, many people are disconnected. I'm sure you've seen them. It's called disassociation.
Yes.
And they can't tell when their body is reacting.
Okay.
And that's part of the training I do to teach therapists other ways to know when that frequency is at the right setting.
So it's the subjective experience.
That's the process.
It's the subjective experience of the client as they're lighting up. That means that they are sensing being present in all aspects of the trauma with all of their five senses. And then when the sound comes, that what you call it resonating is when their senses becomes heightened and it actually becomes so vivid to them. And that
Yes.
to you is so it's their feedback, their verbal feedback about what's going on in them that is telling you if this is.
Not verbal. They're waving at me.
Oh, they're waving at you. Okay, so they're waving.
I don't want verbal.
I got it. Okay, perfect. Now, I'm sure that because you're in the field of trauma, you have heard of eye movement desensitization and reprocessing. And for the audience to just say, Dr. Francine Shapiro created this model called eye movement desensitization, which it was called because of the first findings were with the eye movement, where the client sits down and they wave their fingers or light and moving the eye from one side to the other or up and down or diagonally. And then they found out it can also be with sound or it can be by tapping. And you know that also has done magical work. I've been also a practitioner of EMDR for almost 20 years and has done magic, especially in the incidental post-traumatic stress disorders. Tell me a little bit about your findings about the difference between reset therapy and EMDR.
Well, I hope I don't upset you, but again, I've done a lot of research on this second book, and mega studies are suggesting that cognitive behavioral therapies, exposure therapies are only about a third as effective as we once thought they were.
Right.
Personally, I don't believe talk therapy helps with trauma, period. And I'll quote Dr. Van de Kock, who's an expert in the field, of course, suggesting that the seat of it is in the limbic system, the amygdala, and you don't get to talk to the amygdala. It gets to talk to you. So, once again, I do talk work, and I'll use the learning I've learned in all the years I've been in the field, which is 45, after the brain has reset and the growth mode is back. Mm-hmm. That's when talking for me makes sense.
Okay.
You asked about EMDR. If I can reset the brain in 1 to maybe 4 sessions as compared to weeks. Now, there are 8 stages in EMDR.
Yes.
That takes time.
Yes.
And we've got thousands and thousands of people that are traumatized. And we have 22 vets, mostly from Vietnam, killing themselves every day.
Yes.
I want to get something out there that I can train people in quickly and get them helping people. So I'm not putting down EMDR. I've used it myself with some people that were disassociated just to get them to connect, and then I go back to neuromodulation.
Got it. Okay, perfect. Now I've noticed that you are in a Winnebago, and I'm thankful that although you're on your vacation, that you agreed to do this interview with me. I'm really, really grateful. So tell us where you are.
Well, I'm on a permanent vacation because at 76 I'm supposedly retired.
Oh.
Now, my wife doesn't think I am, but I like to keep busy. At any rate, Sarasota, Florida is like a pressure cooker in the summer months.
Yes.
I am in the mountains of Asheville.
Oh.
Beautiful, beautiful location. Cool. In my 29-foot Winnebago.
Yay.
I keep it in storage the rest of the year, and I'm up here for 2 to 3 months per year.
I'm jealous.
Well, you should be.
We're in California and cooking, although I shouldn't nag about California weather, but I'm jealous to where you are. 2 to 3 months, in the beautiful mountains.
Absolutely.
So where, if somebody that they're watching, they get interested in the treatment, do they have to come to Florida, or are you training other therapists around the U.S., or is it exclusive that they have to come to Florida to be with you and work with you?
Well, at this point, I've trained my first cohort of 6 therapists in Sarasota, Florida. In Asheville, I'm looking to get another group together. In other words, I would like to form core groups around the country. When I go back to Sarasota, I'd like to start another group and have a videographer be able to record parts of it so I can begin to do webinar type of work, which means groups across the country or overseas. I do think we need hands-on expertise. And 2 things I want to make sure I get in. I told you about the 36 vet study. I want to get into that.
Please.
And I also want to tell you how I certify people.
Please.
Can I start with that first?
Absolutely, yes.
Well, I had an actor friend who role-played the part of a Vietnam veteran with trauma. Now, he never served, mind you, but 2 of the trainees were in tears when they listened to his story. That's how authentic he was. I was sitting there with a checklist, checking off items that they covered, such as explaining resonance and binaural sound and all these things. And as they attained 80% of the items on that checklist, they were certified by me in reset therapy. Because I take this seriously, I don't want anybody treating our vets that doesn't know what they're doing.
True.
So this is crucial, and I think hands-on training is absolutely essential.
Okay.
The first thing I train my trainees, by the way, is to stop using the words think and feel. Do you know how hard it is to get someone to stop doing that? It's ingrained into our therapist psyche.
Yes.
The 36 Combat Veterans Study, we have a proposal before a Human Subjects Committee right now. I expect to be hearing in the next week or so, giving us approval or suggesting modification, and then we will proceed to elicit $200,000 to conduct this study on 36 combat vets.
Great.
There will be 12 from Vietnam, there will be 12 from Enduring Freedom, that kind of time, and there will be 12 from Iraq, Afghanistan. Now we'll have 4 of each of those in 3 different cohorts, so we're not just doing one group at one time.
Sure.
We will do reset therapy. They will get from 2 to 4 treatments. We expect their PTSD to clear by then.
Great.
We will screen out people with complex trauma. A lot of folks go into the military that had earlier trauma in their life. But for this study, we want to deal with the incident-specific group. All right, I'll take a breath.
All right. As you were talking about the research that you will be conducting, I also remembered Seligman, who created positive psychology, and he was also doing a lot of work with the veterans and doing a lot of study with the veterans. Now, I know that you already kind of stated and exclaimed that cognitive and talk therapies are not something that you believe in for the extreme traumas. But do you have any opinions about how positive psychology also works? Is it more like after, as you said, after you reset the brain, then all of those cognitive therapies, including positive therapy, can work?
Well, here's the wonderful thing about reset therapy. Once the neuronal system reconnects, whatever you've been trained in and you're comfortable with will make sense to your patient. They will understand you and benefit from it. But if they're shut off from the part of the brain that does executive functioning, how can we expect them to understand?
Right. Right. So
It doesn't make any sense to me.
you're making the process of a person connecting with themselves and their brain activity coming out of the freeze and defensive mode and the survival mode first, for the brain and the person as a whole to be able to actually shift and move on with life. And you're saying just by talking to someone necessarily, one, it might not work. Two, even if it works, it might take too long. And three, in the process of it working, if they're just talking about it, that they might re-traumatize themselves, and therefore it actually creates worse memories for them and prolongs this type of survival defensive mode. So with research therapy, as soon as possible, the brain becomes alive, just to use the word, becomes alive again, becomes present in the moment again, and then from there on, we can take on the person and move them along.
You got it.
Okay.
Now, my third book is on comorbid conditions. I've got that probably 2/3 done.
Okay.
That's going to include chronic pain. It's going to include survivor's guilt. It's going to include depression and addiction. Reset therapy is showing itself to be viable in all of these domains. I also informed you, and will again, that I've just written a paper on chronic fatigue syndrome,
Yes.
a case study,
Yes.
and my patient is free of the symptoms of chronic fatigue. It took 4 months. I counseled her through email and telephone. She purchased a bod. I did a home visit, showed her how to use it, and we took it from there. So this is a treatment modality, particularly with people that can't get into the therapist office, that can gain something from it.
That's fantastic. It's also a lot of hope for pain medication, as you're talking about, because of obviously, as you know, the amount of painkillers and the addiction to the painkillers are all over the world, and especially United States, it's rising. So this would be an amazing tool for people who have pain, and for them to be able to take care of themselves, even if they don't have the ability to come to the therapist office. If they have that module, what you can do is to work through Skype or telephone or remotely with them to manage, for them to manage their pain.
Let me give you yet another thought. Let's assume you're in a firehouse, and when you came on board as a fireman, someone took your settings for little kind of unsettling events you've had in your life, but they have the settings for the trauma neuronal circuit. Now you're out there 2-3 years later and you run into an incident of some terrible thing that's happened to a child or a family or whatever have you, as first responders do. You come back to the firehouse, you take out that bod, you set the settings, you put that into the sound. You don't get PTSD because it doesn't consolidate.
Oh.
This is preventative.
Fantastic.
It's
so
so
it's not
exciting.
Yes, so it's not just that you have to be traumatized to be utilizing this. You can prevent trauma with this device,
Yes, if you get it before it consolidates in the system.
which is
And
the
that's
24
within
hours.
to maybe a day or so. Yeah.
Okay, perfect. Thank you so much. Again, I mean, I'm really honored that you are on your vacation, your summer vacation, and you decided to be on my show. Thank you for great information. Now, if people wanted to talk to you, I would assume that they can just go through email. We have it on. They actually have it is Lindy123@gmail.com. Don't worry
Correct.
about, they put in www on top, but that's not it. It's just the email. glindy123@gmail.com is a way to be able to contact Dr. George Linden. And thank you so much for being on my show. It was really eye-opening for me. I learned a lot from you. And hopefully, as you have more research coming up, that you can be with us in our show and talk a little bit more about your new findings.
Wonderful talking to a knowledgeable person. Thank you.
Thank you. Take good care. And for all of you, thank you for being with us. And until next week, create a wonderful day and world for yourself. Bye-bye.